So let's go ahead and get started. As you know, we are providing this orientation in anticipation of you going live in APD iConnect this week. Today we're going to cover the things that you will need to know as agency and solo providers of respite and personal supports, what you can expect in the next 24 hours or so, and what you and your staff should do once they have access to APD iConnect. Before we dive into the nuts and bolts of today's meeting, I do want to take a few minutes and just put your minds at ease when it comes to billing. There have been a lot of comments, questions, and concerns over the last several months about what the transition to iConnect will mean for you in terms of how, as providers, you'll submit your billing. So I just want to make it very clear. There will be no change to how you are going to submit your claims or billing right now. You will continue to bill like you always have via the FIMIS portal. When it is time for claims to go live in APD iConnect, there will be a lot of advance notice. There will be additional training. And so again, I don't want anyone to worry about that. You're going to continue to do your billing the way you have been doing it. What is going to change is how you document the service that you deliver. And when I say the service, I'm focusing solely on respite and personal supports right now. So again, no change to billing, take a deep breath, and then let's go ahead and talk about some of the other things that are coming. I do want to clarify that the CDC Plus program has its own EVV system. Some of you may be providers who serve consumers that are enrolled with CDC Plus. So what that means is that if you provide services to individuals enrolled in CDC Plus and you provide services to individuals on the iBudget waiver, you will be working in two different EVV systems. For consumers on the iBudget waiver, you will be using APD iConnect EVV mobile site. And for consumers enrolled in CDC Plus, you will be using the CDC Plus EVV system. I wanted to take a moment and provide an update on the implementation schedule. During the fall of 2020, we brought two pilot groups into APD iConnect. One group was respite providers, and the other group was personal supports providers. These two groups of providers have been successfully creating service logs in APD iConnect for months. The third group was transitioned to APD iConnect on December 8th, 2020, and along with our pilot groups are now using the APD iConnect EVV mobile site. The rest of you have been invited to attend this session because it is your turn now to transition to APD iConnect. Just as a reminder, please stop by and check out additions to the APD iConnect e-learning library on a regular basis. You can see that we've got the link listed right here on the slide, so you have that quick reference. And then also, we've been adding a lot of information to the e-learning library over the last several weeks. Our most recent addition has been the multi-factor authentication page, the subpage that you can see here on the left. This will include information that you can use to learn more about ID Pass and how to get your access to APD iConnect. So again, make sure you check back on a regular basis because we've also been adding more videos and more documents for all of the basic things that you and your staff will be doing from the very beginning. For several months now, the region provider enrollment staff have been contacting respite and personal supports providers to complete their ID Pass registration. You've been invited to attend orientation today because you've completed your APD iConnect training and you completed your ID Pass registration with your region. Tomorrow, you will receive an email that looks like the one here on the screen. This is the email that you will use to complete your identity proofing and finish setting up your ID Pass account. Once you have done that, you will have your login credentials and be able to begin accessing APD iConnect. So there's a couple of important points. One, be on the lookout for the email tomorrow because I just told you it was coming. And make sure you double check your spam folder if you don't see it. 2, when you click on this hyperlink here in the middle of the screen, make sure that you have plenty of time, uninterrupted time, to be able to complete the process. Because if you are inactive for more than 20 minutes, then you're going to get timed out and you'll have to contact the help desk and request a new email and start over. The other really important thing to remember is that this email expires in 5 days. So if you get it tomorrow and you don't read it until next week, it will be expired and you will have to contact the help desk and request a new email. So you want to make sure that when you get the email, you complete the steps as soon as possible. One of the things that changed with the latest update to the iBudget handbook is that when a service goes live in APD iConnect, all documentation for that service is required to be entered into APD iConnect before the provider can bill. So what that means is tomorrow you're going live and you're going live for respite and or personal supports. So that means every single service log for every consumer that you serve must be entered into APD iConnect starting tomorrow. For agency owners, that also means that if you have staff that deliver the respite or the personal support services, they also need access to APD iConnect. Your ID Pass account gives you the ability to request access for them. And once they get their access, then they need to have their service logs entered into APD iConnect before you can submit your billing. So this is really, really important. This is like your keys to the kingdom right here. And you want to make sure that you get this email, you complete your ID Pass registration. If you're an agency owner, you request access for all of your employees that need access to deliver respite and personal supports so that you can stay in compliance with the documentation requirements prior to submitting your billing per the new handbook. For our agency providers, once you get registered with ID Pass and you complete that first login through ID Pass, you will then be able to go ahead and begin requesting access for your employees. So again, this only applies to the agencies. Solo providers don't need to do this. When you're requesting access for your EVV workers, or your personal supports and respite workers, to say it differently, one of the things that you're going to want to do is use your ID Pass account to do that. You're going to request the service provider worker role for those employees, and you want to make sure that you request access to both the iConnect main application and the EVV mobile site. It's really important that you stress to all of your employees that they cannot share their login credentials with anyone else. Remember, APD iConnect is a statewide data management system, and that you as agency owners are bound by the HIPAA regulations and the Code of Federal Regulations regarding confidentiality. So you don't need to give this access to every employee, only the employees who need access to do their job. So for right now, we're looking at personal supports and respite being the services that will go live. Those are the only employees that you need to give access to. And once you request access for one of your employees through your ID Pass account, that employee will receive the exact same email that you received. So we added the screenshot in again because you're going to want to show this email example to your employees so that they can be on the lookout for it. They're going to click on the link just like you do, and they're going to have 20 minutes to not get timed out to complete the process just like you do. So again, if you need more information about the ID Pass system and multi-factor authentication, remember there is a subpage now in our APD iConnect e-learning library that is specific to multi-factor authentication and the ID Pass system. So let's take a few minutes and talk about what you as providers need to have on hand in terms of equipment. And again, this is whether you're an agency or a solo provider. For access to the main APD iConnect application, you're going to need a device. And when I say device, that can be a desktop, that can be a laptop, that can be a tablet. You could potentially manage it on your cell phone, but that's really small to look at. So we would recommend something that's got a monitor, or at least the size of the screen of a laptop or a tablet. And that device has to have internet access and a browser. In terms of accessing the APD iConnect EVV mobile site, you're going to need a mobile device. So in that case, not a desktop. And that mobile device needs to have internet access and a browser, as well as having the GPS location tracking enabled. Because remember, the primary purpose of electronic visit verification is to ensure that the services are being delivered where they're supposed to be delivered when it's a service that's provided in the consumer's home. So again, for that, you're going to want a mobile device. Now, I know some providers have homes where individuals live in supported living, and they may also receive personal supports, and the services always begin and end in that home where the individuals live. So one of the questions that we receive on a regular basis is, can we have just one device in that home and all of the staff will, and this is the language that we're hearing, clock in, clock out. You'll hear me say more often, start or end an EVV delivery. Same thing, clock in, clock out, start or end an EVV service delivery. If everything is happening in one location and you're not anticipating that there'll be any change of location, absolutely it's okay to have one device that's dedicated to that location. But for our staff that are going to go from Johnny's house to Susie's house to Karen's house to Joe's house, then they're going to need something that's more mobile. When we say mobile device, again, that could be a laptop, a tablet, your cell phone. And it just has to have internet access or a data plan and a browser. It is not appropriate for providers to use consumer equipment or Wi-Fi access. I'm going to say that again. This is really important. It is not appropriate for providers to use equipment or Wi-Fi access that belongs to the consumers. Providers need to have this equipment, and you need to be ready, which is one of the reasons we wanted to originally have the webinar, was to refresh your memory that you need to have this equipment up and running and ready to go when APD iConnect goes live for you. One of the really important things to remember is that with the new handbook that was recently promulgated, once a service goes live in APD iConnect, providers are required, per the handbook, to place all of their documentation for that service in APD iConnect before they bill. So that's a big change. And so what that means is that if you are a respite provider or a personal supports provider, once you're activated for APD iConnect, once it rolls out to you as a provider, from that day forward, every single service log for respite or personal supports has to be entered into APD iConnect. Once EVV goes live, every single service log has to be entered through the APD iConnect EVV mobile site. So in order for you to be able to be in compliance with the handbook, you have to make sure that you have the equipment ready and that your employees know how to use it and access either the main APD iConnect application or the APD iConnect EVV mobile site. We do get lots of questions about, well, how do I know if the equipment that I have is going to work with APD iConnect? If you go to the APD iConnect e-learning library, to the main page, you will be able to see that we actually have a link where you can open and download the minimum system requirements document that you can then take to whoever manages your IT for your agency. For some of you, you have a contract with somebody who is your IT person. They manage these things for you. For others, it might be a friend that is just a little bit more computer savvy than you, that you can show them the document and they can say, oh yeah, I can set that up for you. That's really easy. We just need to turn this on, turn that off, those kinds of things. The really big thing that, because it's a long document, but the one thing to keep in mind that in the main APD iConnect application, you do want to make sure that you enable pop-up windows. That is really important because most links within APD iConnect open a new window. And if you don't enable your pop-ups, you can click all day and nothing will happen. So again, as agency owners, for the equipment that your employees are going to use, you want to make sure that all of the equipment meets the minimum system requirements and that your employees know how to use that. So if you've got one machine, make sure the pop-ups are enabled on the one machine. If you've got 6 machines, make sure the pop-ups are enabled on all 6 machines, those kinds of things. Now, again, I just mentioned that one thing because I know that that's a really important thing, but you really do want to download this document so that you can see all of the minimum system requirements. Also, let's take a moment and talk a little bit about browsers. One of the things that you'll see in this document is that as of the date that this document was generated, and I want to say it was August or September of this year, the only browser that is certified compatible is Internet Explorer. And as many of you may remember from your training with your regional trainer, that was one of the things that they walked you through, is making sure that you were using Internet Explorer. APD iConnect will work with other browsers like Chrome and Edge and Firefox, but there are some things that may not work as well with those other browsers. So that's one of the things that you want to be aware of, is that if you are using another browser, that you may find some system inconsistencies. I can tell you that one of the things that WellSky is working on is making sure that APD iConnect is compatible with other browsers. So that's coming. Some of those little glitches that you might see in Edge or in Chrome, those are going to go away in the future. Again, you can use them now, but there might be some features and functionalities that don't work exactly as designed. So it is our recommendation that you use Internet Explorer until the other browsers are certified. In terms of the EVV mobile site and your mobile devices, the mobile site itself is not compatible with Internet Explorer. So there's a little bit of confusion there. We're saying that for the main application site, you need to be sure that you're using Internet Explorer, and yet for the APD iConnect EVV mobile site, we're saying don't use the Internet Explorer. The EVV mobile site has been tested and works well with Firefox, with Chrome, with Safari, and I'm not sure that we've tested it with Edge yet, but I do know with the others that it does work with those. So again, keep that in mind when you're looking at your mobile devices. You want to make sure that you're using one of the other browsers. For our Apple users, again, the system itself is certified compatible with Windows operating system, not so much the Apple operating systems. But again, if you're using something like the Chrome browser in your Apple system, you should be fine with that. So for our agency providers, in addition to making sure your employees know how to use the equipment, you will also want to make sure they know how to complete the steps that they need to complete in either the APD iConnect main application or the APD iConnect EVV mobile site. We have been building training material in our APD iConnect provider library that contains a variety of ways to train the same information. We have videos, we have documents. We do have one self-paced webinar that will walk your employees through step by step how to deliver an EVV service and access the EVV mobile site. In addition to that self-paced webinar, we have a document that then can be used by your employees to follow the steps and log into our training EVV mobile site and actually deliver an EVV service. So there's practical application as well as having documents, downloading them so that they have their own little training manual, or you as providers might decide that you want to have a group training with your employees, however you choose to do it, whether, because of COVID and social distancing, maybe you're scheduling a Zoom meeting or a Skype call or a Teams meeting, and you're pulling everyone together at the same time, or maybe a couple of groups at different times because people are out providing services, but you're having them watch the videos together, you're going through the steps together, and then they're also having an opportunity to do the practicing with the EVV service delivery afterwards. Or you could simply choose to give them the link for the provider library, and you could tell them what videos or documents they need to review and let them train themselves independently. Whatever works best for you and your agency and your employees. That has been left up to you, but we have put the material there in the library. Because we have a lot of material in our e-learning library and all of the various subpages within, I thought it would be helpful for you if I gave you the recommended order of modules and the location of those modules so that you can set up your own employee training. Again, however you choose to do it, whether it's a group training or they're each going to complete it individually. But this is the order that's recommended, because if you start on the APD iConnect Learning Resources page and you start with these two videos, the APD iConnect Basics video and the overview of the Consumer Central Record video, that will give everyone a good overview of just the nuts and bolts of how APD iConnect works. And then from there, you can transition to the providers library page where you can focus on things like how searches and filters in APD iConnect work. Most importantly, I know this is going to matter to many of you, how your staff will add their service logs. There's a video and a companion document. So if some people do better watching a video, they have that. If other folks need a little something on paper to work from, we have that companion document. And then the last item, which I mentioned earlier, is our self-paced webinar for how to use the APD iConnect EVV mobile site and deliver a service. This also has a companion document, and that companion document walks you through step by step what to do to actually log into our training EVV mobile site and deliver a service. So we put that information together for you. And again, this would be, think of it like a syllabus. This would be your syllabus for your employees' training for APD iConnect. Some of you may have office staff, or you yourself will be coordinating the EVV activities for your business. In addition to the training modules that were listed on the previous slide, there are 3 other videos that you or that designated staff person will want to watch. And these focus on things like assigning EVV workers, because remember from your training, if you don't assign someone as an EVV worker for a consumer, when they log into the EVV mobile site, they won't be able to see the consumer. So that is one of your key starting places. And then the other videos that are available are how to review and your EVV activities once they're uploaded and justify any violations that may exist. And then the last one is creating a manual EVV activity. And that is what you will use in those instances where maybe the EVV mobile site wasn't available, there wasn't cell service, or there wasn't internet connectivity, or it was after a storm, those kinds of times where the service is delivered without logging in and accessing the EVV mobile site. So that video will walk you through that. Those 3 activities, assigning the EVV workers, reviewing the uploaded activities and justifying violations, or manually creating an EVV activity record, those can only be done by the person who has the provider EVV manager role. So again, that may be you yourself as an agency owner or solo provider, or you may have a person in your business who is designated to fulfill that role. So again, these are 3 additional training videos. You still would want that person or you yourself to watch all of the modules that were on the previous slide. for all of the providers who have already been through training, you know what the benefit is of that hands-on practice. So if you would like to have your training account reactivated so that you can share that with your employees so that they can practice as well, or maybe you yourself need a refresher, you can go ahead and send an email to the iConnectedAPDcares.org email address, and we will coordinate with your regional trainer to get the accounts reactivated for you and send you back the login credentials. That in this one instance, you can go ahead and use that one login and share it with your employees. Remember, in the actual live APD iConnect site, you're never going to share your login credentials. But for the training site, you can go ahead and do that. So we wanted to make sure that you have the ability to give your employees or yourself access to your training account so that you can practice before you start using the live APD iConnect site. We never, ever practice in the live APD iConnect site. That is live consumer data. That is their official client central record. So we never practice in the live site. We only practice in either the training site or the training EVV mobile site. Now, you've heard me reference the APD iConnect e-learning library, the provider library, several times through today's presentation. I do want to take a few minutes and just remind you that we have a frequently asked questions section, an FAQ section. We do want providers to check back and review those on a regular basis before you send inquiries asking, for example, how do you record services that are provided in a 1:2 or a 1:3 ratio? Check back to the FAQs first to make sure that that question hasn't already been asked and answered there. It'll be faster for you. As more and more providers are coming online with APD iConnect, we're going to be grossly outnumbered in terms of how many of us can answer your emails and your questions. So again, we are creating this place where you can get the information when you need it. And we want you to go ahead and use that. So in just 1 second, I'm actually going to break away from this PowerPoint presentation and just go in and show you a couple of things on the FAQ site just to demonstrate the information that's available. So if you get stuck, don't worry, you're not alone. We're here to help. Remember, though, that if you get stuck on how to do something or how to navigate in APD iConnect, we do have the APD iConnect e-learning library, and there are all kinds of resources there. So we suggest that you start with the e-learning library and the FAQs. And in a few minutes, I'm going to take a tour of that with you so that you can see exactly what I'm talking about. But if you need to talk to someone, we're here to help. And you can contact the APD iConnect support desk at 800-353-5168. We do ask for your patience because with so many providers going live this week, the call volume may be high. When you call the APD iConnect support desk, the agent will do their best to resolve the issue or answer your question. If they can't answer your question or resolve the issue, then they're going to route it over to the APD help desk using their Jira ticketing system. So they'll go ahead and give you that Jira ticket number. Our APD help desk staff will also receive that Jira ticket, and from that, they will create a Zendesk ticket. You actually will have the ability to log into Zendesk and check on the status of your ticket. I've got the link here on the slide, and it'll also be included in the handout that you'll be receiving that includes the PowerPoint presentation. Now, if you haven't logged in through the Help Desk web portal before, you will have to request a password. And using that URL, that link that I had on the previous slide, that will bring you to this APD IT support services screen, and you simply click on the sign in button. The sign in button at the bottom, you can see that there is a link for you to request a password. From there, it's as simple as entering your email address, clicking submit, and then you'll get this pop-up that tells you to check your email. It may very well go to your spam folder, but what you're looking for is an email from the APD IT support services. That email will have a link that you can click. And when you click on it, it will launch this window where you simply type in your name and you create a password. The password requirements are listed here at the bottom. And as soon as you've created a password, you can go ahead and click that Set Password button. And if your password meets all of those requirements, then you will be automatically signed into the APD IT Support Services web portal. And now you can just click on the Check Existing Ticket button to be able to check on what's happening with your ticket. Any tickets that have been created by you or for you will be listed in the list below. So you just choose the ticket from that list that's available. And if this is your first time logging in, there will probably only be one, but you click on that to be able to see what the status is on that ticket. And once you click on that ticket to open it, you'll be able to see the entire history of that ticket. Your comments, any comments from your help desk staff. There's a window in there that you can actually communicate directly with the help desk in there. If you needed to add screenshots or documents, there's a place to attach those. We do recommend that if you can take a screenshot to help our help desk staff see where it is that you've gotten stuck, that would be extremely helpful. It's really important, though, that you remember never to send protected health information in a help desk ticket, in a Zendesk ticket. That includes not just not typing information that's PHI, but also if you're attaching any documents, that you make sure that there is no protected health information in those attached documents. This is an example of what a ticket history looks like. In this example, Susie Provider has contacted the APD iConnect support desk to report that her ID Pass email has expired and requested a new one. From there, it was routed over to APD and a Zendesk ticket was created. And here you're able to watch the back and forth exchange of communication between Susie and the help desk staff. Now, if for some reason you're not able to log into Zendesk, you can contact the number that we have here on the screen and someone will be happy to assist you. And that is our quick introduction to Zendesk. Why did I tell you all of that? Because one of the things that we hear all the time from new APD iConnect users is, I contacted the support desk and nobody ever called me back. And that's because if your ticket is routed to the APD help desk, you're not going to get a call back. You're going to be contacted through the ticket itself. And so that's why we want you to know how to access your ticket, check on the status of your ticket, and if need be, communicate with the help desk staff. So that's how we access the help desk tickets. So in summary, to circle back to what can you expect and what should you do, the first thing you should do is access the APD iConnect e-learning library and review the material in that order that I presented on those earlier slides. If you're an agency, please also make sure your staff do the same thing. And then tomorrow, be on the lookout for your email to be able to complete your identity proofing and set up your ID Pass account. For those of you who are agency owners, once you have your ID Pass account set up, immediately start the process of requesting access for your personal supports and your respite staff. Make sure they complete their identity proofing as soon as possible as well. The next thing that you're going to want to do once you've logged into APD iConnect is go to your provider record and click on the EVV scheduling tab so that you can assign your EVV workers. You'll see when we go and do the tour of the e-learning library, there's training material on how to do that. For our agencies, one of the things that I stressed a moment ago is that you want to make sure that your employees complete their ID Pass registration and log into APD iConnect, because if they don't, then you won't be able to see them to be able to assign them as EVV workers. So again, you want to make sure that your staff complete their ID Pass registration and they log into APD iConnect at least one time. Once they've done that, you'll be able to see them in a drop-down list and be able to assign them to consumers as EVV workers. After you've completed the EVV scheduling, you and your staff are set up to begin using the APD iConnect EVV mobile site. And you can do that by when you log in through your adaptive user portal. Beside your APD iConnect icon, there's this icon that I've got here on the screen for the iConnect EVV mobile site. Click on that, and that will take you directly into the APD iConnect EVV mobile site. You and your staff can begin doing EVV service delivery and creating your service logs directly in the EVV mobile site, and then upload them into APD iConnect. And that will meet the requirement per the new handbook of having the documentation recorded in APD iConnect before you submit your billing. So that is our meeting for today and the information that we have. I do want to take a few minutes and jump from this PowerPoint and do a quick tour of our e-learning library. I hope you found this information to be helpful. I know you're all familiar with the public website, but to get to the APD iConnect pages, you simply go to Waivers and then click on APD iConnect. And that will bring you to our main APD iConnect page. On this page, we'll have two important pieces of information for you. If we scroll down, you'll see here is a link for you to go ahead and download the document with the minimum system requirements, and that will be a resource for you to make sure that your laptop, tablet, cell phone, desktop, whatever device you're going to be using for APD iConnect and the APD iConnect EVV mobile site meet the minimum system requirements. We also have the information for our APD iConnect support desk in case you need that, and you'll find that this number is virtually everywhere. And then further down, you'll be able to find information about our implementation schedule and training. So this section changes on a regular basis. You can see here that as of today, it's still updated for fall and winter of 2020. We are in the process of getting it updated with our 2021 dates. So check back here often for those updates. Let's go ahead and scroll back up. Just want to highlight a couple of the important links that you'll see here to the left. I did reference some of them in the PowerPoint presentation, but I want to show you how to find them. Let's start with that multi-factor authentication page. This is where you can get information about ID Pass. You hear us talking about ID Pass. You have the ability to view the video regarding multi-factor authentication and the ID Pass system. This is the exact same video that you saw on day one of your training. And I know for many of you, that feels like a million years ago. So we wanted to make sure that it was accessible for you. Also, to go along with that video, we have the actual document that goes with that. So you can get that information there. And then there's additional information down on the screen for you to review. The other thing that I wanted to mention is that, as you recall in the PowerPoint presentation, I talked about how our e-learning library has videos and documents for you to be able to review either as agency and solo providers, but also for our agencies for your staff to review. This is how you'll be able to set up your staff training so that your staff can start using APD iConnect. And for those who provide the direct respite and personal care supports, they'll be able to learn more about the APD iConnect EVV mobile site. So again, just to show you where to find that, remember in the PowerPoint, there are a couple of slides that show you the best order to follow, and you'll get the document with that goes with those slides so that you can have them for reference later. But again, I just want to show you where to find those videos and documents. So if you start here on the APD iConnect Learning Resources main page, you'll see right here, almost in the center of the screen, is the e-learning modules with the APD iConnect Basics and the overview of the Consumer Central Record. So what this is just really basic information about APD iConnect. What's a note? What's a tickler? How do I add a recipient to a note? How do I upload an attachment? Those kinds of things. And then the overview of the Consumer Central Record shows you all of the information that's available in the consumer's record. Now you'll know from your training that what you're able to see in APD iConnect is tied completely to the role that you use. So in that video, there will be more that you'll be able to see than what you'll actually see when you start using APD iConnect. And that's because some of that information isn't necessary for you to be able to do your jobs. And then if we go over to the provider library, you can see here we've got a lot of information that's strictly for providers. The provider training guide, many of you downloaded this already when you went through training. We try to keep our important news at the top updated so that you have that information. These are videos for groups that have gone live in APD iConnect before this group today. So if you want to go back and look at those videos, you can, but we went through that same information today in the PowerPoint presentation and as I'm going through this tour of our APD iConnect web pages as well. So it's the same information, but towards the end of each one of those videos, there's also the Q&A that came out of those. So you're welcome to touch on that just to see if there's more information there for you. If we scroll down, I want to highlight our e-learning module section here. These are the videos that I referenced on that slide about, what you should watch as an agency owner, what your provider EVV managers should watch, and what your staff should watch. So that's what these videos are, and many of them also have companion documents to go along with them, because some people learn well watching videos, others learn better having something to look at. So we do have some cheat sheets, some reference guides for you to be able to look at to help go through the steps of completing things. There are a few documents that are listed here that I do want to point out to you, and there are 3 of them. This APD iConnect External Provider Import Training Guide, the WellSky 837P Companion Guide, and the APD Provider Activities Import Field Spreadsheet. These 3 documents are only for providers who currently use an external electronic health record system, or an EHR. We do have the ability for providers who have an existing EHR system, if you want to continue to use that and import your service logs for things like in the future, I'll just say service logs for supported living, for example, you would be able to use our external provider interface to send that information from your existing EHR system into APD iConnect. We do have 3 videos that are specific to that, and those are down here at the bottom in the video presentation section. And this is the External Provider Interface webinar sessions 1, 2, and 3. Session 1 goes over all 3 of these documents. Again, this is nothing that's required. It's an option that's available, and it's not necessarily for every single provider. We're not going to talk today about the external provider interface. If you have questions about that, watch the videos, download the documents. I did just want to highlight that they are here because I know that we've got some providers on the call today that are interested in that. So let's go ahead and scroll back up. We also are starting to keep a record of providers' tips and tricks, things that we have learned based upon the pilot groups that have already started using APD iConnect, the groups that have come into APD iConnect after the pilot groups. And so as we hear things from them, we're pulling that all together and listing them here. So these are short documents or a video that just kind of walks through some shortcuts and some tips to how to just navigate more efficiently through APD iConnect. So I wanted to mention that. And then the other thing I wanted to highlight today, two other things. One, we do occasionally take this system APD iConnect offline to do maintenance. That typically happens Thursday evenings between the hours of 6 and 9. And we send out a notification from our help desk, our APD IT support, that lets you know when the system will be offline. So be on the lookout for those. When we make those kinds of system enhancements, if you want to see what happened. So let's just say, for example, if tonight were Thursday and the system was due for maintenance, so we took it offline. Tomorrow you come and you want to see, well, what were they doing? We are listing our system updates and enhancements here. We break it down by month, so you're able to see, one, which user group was affected, and two, what did we do? So that information is available for you. And then the other thing I wanted to point out was our FAQ page. I cannot stress enough that the answers to most of the questions that you have are going to be here in our FAQs. I promise you, at this stage in the game, if you're thinking of this question, somebody else before you has already asked it, 90% of the time. So we've taken our FAQ page and we've broken it down into user groups. So of course, you can look at any of them, but you'll probably want to stay focused in the providers page. And then in the providers FAQ, we've broken it down into various different subjects: access, authorizations, claims. And again, I'm just going to say it again. Remember, as of today, nothing is changing in how you submit your claims. But if you've got questions about what's going to happen in the future, that information is here. I do want to scroll down though and show you what we've done with our EVV FAQs. This is brand new that we have just done in the last few weeks. And what we've done is we've taken our FAQs for EVV and broken them down into different sections, because as you can imagine, with our pilot groups and the groups before you today going live, questions have been adding up and adding up. And so we wanted to break this down into a way that was more useful for you. So we've got our general EVV overview questions, but if there's a new question, as you can see here, we've highlighted them. So if you had checked back here maybe 2 months ago, these questions 18 through 24, they weren't here. So come and check these questions. We've also broken it down into claims, EVV devices and authentication, EVV documentation, lots of subcategories with EVV. EVV violations, workers and roles. So we've given you a lot of information. And since we're talking specifically about EVV services, I recommend each and every one of you come back and check things. Here's our question about ratios. This is one of our most popular questions. How do we do the service if it's a 1-to-3 ratio? The answers are right here. So it'll take you to a new page. You can read the answer, and then you can just go back to the provider FAQ page and look at the next question. So I wanted to highlight that for you because, again, we've been listening. We get feedback from providers all the time, and we want you to know that we are taking that information that you're sending, that question that you're asking, and we are doing our best to tweak the information so that what is here for you is helpful and easily accessible. So again, before you're always welcome to send an email to the iConnect at APD Cares email address. But before you do, I strongly recommend check out those FAQs because, like I said, those burning questions that you've got today, somebody else probably had them before you. And if they've gone live already, then we've already answered that question for them and we've posted it in the FAQs so that it's there for you. So that is our tour of our APD iConnect web pages. Again, I encourage each and every one of you to check back often because, as you can see, we're always updating and adding more information and trying our best to keep that line of communication open with you. So again, I hope this information is helpful to you. Make sure your staff have access to this as well, because remember, in that provider library is all of their training information. And that's our tour of our APD iConnect e-learning library.